About 8 months ago, I started to feel pain in the lower right area of my abdomen. In the beginning, it felt like an abdominal cramp, so I thought I'd just eaten something bad. Or one of the supplements that I was experimenting with at the time was causing some adverse effects. I cut out the supplements and I gave it a few days. That didn't help. I had not experienced any sharp pain during workouts like the kind you get when you seriously injure yourself. So I figured I just pulled something while smashing it up at the gym. Remedy? Just suck it up like a tough guy and wait it out to see if the pain went away. Well, it didn't go away. And after several weeks, I was still biting my lip. Once more, it was preventing me from performing certain exercises, and therefore I couldn't smash it up in the gym. I put it off far long enough, as every macho philosopher instinctively does. And then I finally went to see a doctor. The first doctor that I saw said, "I don't feel anything. It doesn't look like a hernia to me." The second doctor that I saw said, "Hercules?" I said, "No, but I get that all the time." And then he said, "Well, I don't feel a hernia, but let's get some blood work done and set you up for a CT scan." The blood work came back negative, and the CT scan didn't show any maladies, let alone a hernia. And that was the third doctor's opinion, actually the radiologist. Then I went to a fourth doctor, a surgeon, and within 10 seconds he said, "Oh yeah, that's a hernia. Actually, you have two, one on each side." So I contemplated that, philosophized a little bit, and then scheduled the hernia surgery repair. Now, these were 4 reputable doctors that I consulted, and I don't want you to get the impression that medical opinions are worthless and that you shouldn't get checked out by a doctor if you're experiencing a health issue. But ultimately, you know your body better than anybody else, and the decisions that you make regarding your health are your decisions. Definitely get checked out by a doctor if you have something that you feel is serious and doesn't seem to be going away. So I'm doing this video to give an overview of hernias in general, particularly the inguinal hernia, which is the type of hernia that I had, and which is most common among bodybuilders and athletes. Plus, I want to talk a little bit about my experience with diagnosing the hernia, getting the operation, and getting back into the gym to crush yet another day. Now, warning, I'm going to show a lot of pictures of male genitalia during this presentation, so if you have any young pets in the room, you may want to ask them to leave. Also, disclaimer, I am not a doctor. And I'm not giving any medical advice. I'm just relaying my personal experience with a hernia in hopes that it can help somebody in a similar situation. Always see a doctor. Okay, sit back, grab a protein smoothie, and enjoy. All right, what is a hernia? A hernia is when an organ, such as the bowels, breaks through an opening or weak spot in the layer of muscle or connective tissue that holds that organ in place. The excessive pressure that causes hernias can occur from heavy lifting without stabilizing abdominal muscles. It can occur from chronic sneezing or coughing or straining, as in go into the bathroom. That's right, bowel obstructions and constipation can exert a huge pressure on the abdominal wall. There's also great pressure in the abdominal area for women during pregnancy, which can lead to what's called a femoral hernia. Now, the weakness in the muscle or connective tissue barrier can be something that's congenital, meaning it's something that you're born with. This is often the case in umbilical hernias, which is where the intestines push out of the abdominal wall at your belly button. There can be a weak point at this area because at one point in your life, that was your feeding tube. A weak point can also be at the incision site of a previous surgery, which is referred to as a incisional hernia. What happens is that the surgical wound doesn't fully heal and it can open up with abdominal pressure. Now, poor nutrition and certain lifestyle choices can lead to weak tissue walls and make hernias more likely to happen. Habits like smoking and alcohol consumption always seem to be in the lineup of usual suspects. Also, obesity and not getting enough exercise, or any exercise as a matter of fact, these are all contributing factors. There are also hiatal hernias, which are when the upper part of the stomach connected to the esophagus pushes through the diaphragm, causing the diaphragm to choke off that section of the stomach. I've heard that this is extremely uncomfortable. My friend's cat Charlie actually had a hiatal hernia, and he was not one happy kitty. Symptoms include chest pain, choking, and acid reflux. There are a number of other types of hernias, but I'm going to spend the rest of the presentation talking about the type of hernia that I had, which is called the inguinal hernia. This is the most common type of hernia, making up to 75% of all abdominal hernias. It is most common in men, and primarily in men who are athletic and perform strength training. Basically all the gym bros. It gets that name because it's a protrusion of the intestines through the inguinal canal, which is a passageway from the abdomen to the scrotum. That's right, I said scrotum. Have you ever heard the saying, the guy's balls finally dropped? Well, the inguinal canal is the path where that drop occurs, usually before birth. The interface from the testes, that's right, I said testes, to the rest of the man's body occurs through the inguinal canal. Women also have an inguinal canal, but theirs is much smaller and less prone to hernias. A man's inguinal opening in the abdomen is about 1.5 inches in diameter. The surrounding tissue is mostly connective tissue called aponeurosis. And because it's connective tissue, it's weaker than muscle and it's easier for something to pop through there. Okay, how did I know that I had one? Even though, like I said before, the doctors kept telling me that I didn't have one. What convinced me the most was this bubble in my lower abdomen that would pop out and that I could push back in. How does the doctor miss that? It wasn't too noticeable at first, but eventually it became pretty obvious. During a physical, when the doctor tells a guy to turn his head and cough, he's usually checking the inguinal opening down by the balls, called the superficial inguinal ring. If the intestine doesn't push all the way down to that point, then the doctor might miss it. I guess my guts didn't make it that far. I researched all over the internet, and there was absolutely no other reason to have that bump in my abdomen. It also appeared bigger after a meal and would occasionally make a slushy noise when I poked at it, like it had liquid in it. It wasn't that painful, but more of an annoyance. It definitely caused pain if I was in the gym and pushed the workout too hard. That shut me down right away, but I learned to manage it with low intensity, lighter weight exercises. And I would actually have one hand holding the hernia as I performed a unilateral exercise with the other hand. The CT scan that I had done didn't show any hernia, but I was lying down and I'm sure gravity kept the intestines in their place. If I was to recommend to somebody to have one test that would show a hernia, I'd say it would be an ultrasound or something where you can stand up and aggravate the problem. Really, in most cases, you should be able to diagnose a hernia through just a physical exam. I always have to be difficult. I specifically made an appointment with a surgeon for an exam because I figured that he would be the best authority since, well, he performs hernia surgery repairs all the time. You know, like dozens of them, if not hundreds. If you do the same, try to pick a surgeon with a lot of experience with laparoscopic surgeries. A general surgeon will be pretty good too. Keep in mind though that there's a financial incentive with surgeons to perform surgery. So sometimes they may be more prone to cut you up. Okay, why would someone consider surgery for a hernia? The truth is that surgery is the only way to fix a hernia. A lot of people have hernias for years and never even know that they have them. If you aren't experiencing any pain or discomfort, then you probably can hold off on surgery. But keep in mind that complications can occur when you don't treat a hernia. The most serious problem is strangulation of the intestine. This is where the intestine gets trapped in between the abdominal wall and doesn't retract. This can limit or completely obstruct blood supply to the part of the bowel involved in the hernia, which can lead to an infection and yes, even death. You'd know there was a problem though if that occurred. Symptoms such as not having a bowel movement for 2 days or more, feeling nauseous and throwing up. It will be very painful too. And not just the annoying soreness that I was having. You might see bruising in the area. Most likely you'll have a fever if there's any strangulation. If you have any of those symptoms, then you should get to a doctor or emergency room as quickly as you can. If you don't experience any of those symptoms, then you can hold off on any action. I myself waited about 4 months to see how things went and then to prepare for the surgery. The surgeon's office will give you a list of instructions of things to do or not do 7 days prior to surgery. This may vary from surgeon. Some places require 14 days of prep. Whatever they give you, try to abide by it. You're going to have to get blood lab work done, and the surgeon's office is going to have to review it to make sure that you can have surgery. The blood work that you're going to need to get is called the CBC BMP test. 7 days prior to surgery, I was not to take any aspirin-related products or non-steroidal anti-inflammatories like ibuprofen or Aleve. These can thin the blood and interfere with clotting. Also, there was a list of herbs that I was instructed to avoid, such as garlic, ginseng, or ephedra. These have a possibility of reacting with the anesthesia or with blood clotting as well. So I stopped all supplements, including pre-workout mixes and all vitamins. I just chilled out for a week. You're going to have downtime after the surgery anyway, so don't be too worried about getting flabby or weak. You will have plenty of time to get back in prime form after you're fully recovered. I had to avoid alcohol as well, which really wasn't a problem for me. They didn't say anything about not working out the week prior to surgery, but I just laid off the gym about 2 days before going under the knife. Some surgeons will require no gym time for 1 week or up to 2 weeks prior to surgery because that can increase blood flow and risk excessive bleeding during the operation. They're going to recommend washing the abdomen the day before the surgery with a special antiseptic soap like Hibiclens. Here, you can get this at any drugstore or supermarket. I use this on the incision area after the surgery as well. Most hernia surgeries these days are done laparoscopically, as opposed to the way that they used to do it, which was a big, ugly 4-inch incision. I highly recommend that you get the laparoscopy. It leaves less scarring and the post-op recovery is much quicker. We're talking a week or 2 in order to get back on your feet to over twice that for the incision. Laparoscopy is where they make 3 small incisions in your abdomen, usually near the belly button. One incision is for the camera to see what they're doing, and the other 2 are for a clamp and cutting tools. The incisions are so small that they won't even use stitches to close them up. They will either use a butterfly type adhesive strip, or in my case, they use a surgical glue. You will have scars, but this method leaves less of a scar than stitches. The actual operation is where the surgeon installs a biosafe surgical mesh that's either synthetic or is made from animal tissue. I got the synthetic kind. The mesh is laid over the hole where the intestines were poking through to block them and is either sutured or stapled in place. And it's there for life. It doesn't degrade, and if all goes well, then the new connective tissue will interweave and form through it, and you'll have a much stronger wall of tissue than you were even born with. Most of these mesh surgeries will place the mesh on the posterior or inner wall of the breached tissue. This makes it harder for the surgery to come undone and the hernia to reoccur. Make sure that you get this type as opposed to the mesh on the outer or anterior wall of the repaired tissue, because that can just bust out with enough pressure. Now, I was billed by 3 different entities for the surgery. 1 is the surgeon performing the surgery. 2 is the facility where the surgery was performed. This can occur at a clinic or any hospital that the surgeon operates at. For me, there were 3 or 4 choices, so I chose a hospital that was about 4 miles from my house. This was convenient for getting there on time and getting home quickly with traffic and other delays. The third cost, and the most expensive, is the bill from the anesthesiologist. Now, the cost of the surgery will vary depending on your health insurance plan. These days, the surgery is done on an outpatient basis, meaning that you're not admitted to the hospital. Simply go to the site of the operation, they perform the operation, and then you're discharged a few hours later to go home. They want you at the hospital about 2 hours before the operation to prep you, and the operation takes about 90 minutes on average. Mine was only 45 minutes, so I got the express treatment.
Outstanding.
Then you're going to recover for about 2 or 3 hours post-surgery before they let you leave. Plan to be there about 6 or 7 hours. I know it sounds like a long time, but it goes quick. Well, for the patient at least. You're going to need to arrange a ride to and from the hospital because theoretically, you could drive there on your own, but they won't discharge you without a ride home. I suppose that you can take an Uber home, but really you should have a family member or really close friend drive you there, wait, and then drive you home. It really is the best way to go and makes things the easiest. Also, the surgery center is going to want someone to stay with you for at least 24 hours after the surgery to make sure that you're stabilized. This could be the person that took you to the surgery, or you could arrange for someone else. When you arrive at the hospital, They'll check you in at the front desk. You'll have to sign a few forms and permissions and whatnot. Then they'll bring you up to the pre-operation floor where you change into that gown with the opening in the back, and then they stick you in a bed. A nurse comes in and hooks you up to an IV and the vital statistics machines, i.e. blood pressure, heart rate, oxygen level. Then the surgeon comes in and answers any questions that you have. Then you meet the anesthesiologist, and finally, they wheel you away into the operating room. You then move from the mobile bed to the operating table. Have a few laughs with the surgical assistants. Then they administer the anesthesia through the IV port, and boom! You wake up in a different room, in a different bed, with a bunch of other people in beds around you. This is the post-op recovery area, and I was there for about probably 45 minutes to an hour. Let me tell you, coming out of the anesthesia wasn't the most pleasant experience. My teeth were chattering and I was having difficulty fully inhaling. Now, from what I understand and what I could hear from people around me, this was pretty normal since they were all saying the same thing. The nurse finally gave me a little Demerol, and that made things a lot more comfortable. Demerol is an opioid pain medication, in case you were wondering. Then they moved me to a post-op discharge area where the nurses gave me written instructions for post-operation care, such as when to use ice, what to eat, when to take pain medication, and when to schedule a follow-up. They also filled my prescriptions right there in the hospital. Apparently, this hospital had a CVS in it. The doctor prescribed me hydrocodone for any pain and also Docosate as a stool softener. Exactly. The hydrocodone was mostly just acetaminophen, so I had to suck it up and deal with the pain. If you want something stronger, then make sure to ask for it. The problem is that pain medication in general tends to constipate you, and that's to be avoided because that kind of pressure and straining can undo the surgery. Hence the additional stool softener prescription, which is an over-the-counter medicine anyway, FYI. After the prescriptions, you get out of the gown and back into your street clothes. You also move from the bed to a wheelchair. After the responsible doctor releases you, then you're wheeled to the hospital entrance and you slowly and painfully get into the car and go home. Okay, you have your medications and you are safe at home, ready to recover. I know that you would think that you would want to just lay in bed for a few weeks and sleep, but doctors don't want you to do that. They're going to want you to get up and walk around as often as possible, and also go to the bathroom. Their main concerns are to avoid getting any blood clotting that could occur from just lying around, and also constipation, which builds up pressure at the hernia site and can undo the surgery. Try to get up and walk around for a few minutes every couple of hours during the day. You don't need to do this when you're sleeping at night, unless you're a sleepwalker. Also try to get the old bowels moving at least once in the first day or two, with aid from the stool softener if needed. It is beneficial for you to keep things moving in the plumbing so you don't build up any pressure. For the first day, you want to stick to a liquid diet consisting of soups and protein shakes. Don't overdo the protein because that can clog you up as well. Chicken soup with rice or noodles or just the broth alone is good. Then on the second or third day, you can move into rices and mashed potatoes. Fiber is really good to have, so you can eat some peas or broccoli. I would also recommend some soluble fiber supplements like a Metamucil. Just mix up a teaspoon into 8 ounces of water a couple times a day and drink it up. After 3 or 4 days, then you can get back into the meats like chicken, pork, or red meat. Ground meat is better than steak or whole chicken breasts for at least the first week. This is just me, but I would also recommend some probiotics or prebiotics to shore up your digestive system. Greek yogurt, sauerkraut, kefir, or acidophilus pills. Getting in and out of your bed and chairs will be the most difficult part of your day for about the first week and a half. Try to arrange it so there are some things near your bed that you can grab onto as leverage. If you're sitting in a chair, then you can use the arms of the chair. I used a dresser right next to my bed and opened up the top drawer to get a handhold to lift myself up by. You want to use your arms and legs to get up without flexing your core. Also, a trick is to breathe out when you're exerting yourself. That way you don't lock up and strain yourself. We have the habit of instinctively flexing our core whenever we feel pain, anywhere. And that's not helpful for a hernia recovery. You can take a shower a day or two after surgery, but I wouldn't take a bath or get funky in a hot tub. When you do take a shower, just lightly rub soap on the incisions, but don't be abrasive. After about a week, you can scrub the glue or adhesive strips off of your incisions, no problem. Most of the swelling that you're going to get is going to happen in the first 72 hours after surgery. And it's most likely going to hit you on the third day. Mine came on the third day and it was pretty intense. I mean, I was bloated on the stomach, and if you're a guy, strangely enough, your balls get really swollen. That's right, I said balls. It's actually quite impressive. When this happens, throw an ice pack on the area for about 10 to 15 minutes, giving you an hour break in between applications. Now don't apply the ice directly on the skin, but through a buffer of some sort like shirt or pants or a sheet. It's suggested to use small gel ice packs or a bag of frozen mini peas. This way the cold can contort and make contact with the entire area. Swelling should be gone by the 4th or 5th day. There will be some substantial bruising that might be delayed. I didn't have bruising until about a week and a half after the surgery, and it was all over my stomach. Honestly, it was pretty alarming. It will go away though. And if it doesn't, call the doctor right away and have them check it out. But it should go away. All right, this is the part that all you gym junkies want to know. When can you get back into the gym and start crushing it again? Well, you certainly want to take it very slow and be very cautious, because it would royally suck if you caused a relapse and had to redo the surgery. The doctors say no exercise at all for the first 2 weeks and no lifting weights for the first 6 weeks. And then after that, go to town. Personally, and this is only me, I was back in the gym after about 2 weeks because that's when I felt I was up for it. There are some guys out there who are in the gym a week after surgery. That sounds really soon, but you do what you feel you can handle. There's no need to rush things though. Even when I started back up at the gym, I was mainly doing cardio and a few light exercises on the machines. Exercises like biceps don't use the core as much, so I thought it was safe to do those. Back exercises are out of the question for at least a month, in my opinion. Chest and triceps, I waited 3 or 4 weeks and it wasn't that bad. I've trained myself to keep my core loose and not flex during upright chest exercises though. No push-ups though, because that planking stiffens your stomach muscles. Legs, I didn't even touch those until the recommended 6 weeks after post-op. Again, each person is different and will have a different recovery rate. It might help to think of the big picture and the long term. You have a month or 2 of downtime, which sucks, but it isn't that long, and believe me, it will go by quickly. Then you have the rest of your life to smash it up and get back into prime condition with a new armor plating on your stomach. You can take it to the next level. So that's my story. I hope that you got something out of it, even if it was just for entertainment value. Keep tuning in for subjects like this, all relating to fitness, bodybuilding, health, nutrition, and most importantly, philosophy. I'm Maximus Gaines, and now you know something.